Hello, everybody. I'm Dr. Noha Polak. I'm one of the pediatricians at Progressive Pediatrics. We're located in Hudson County, New Jersey, in Union City and in Bayonne, and we're here to take care of your whole child. I'm here with my guest, Dr. Melanie.
Hi, everyone. Thanks for having me, Dr. Polack. So I'm Melanie Llanes. I'm a physical therapist here in Jersey City. My practice is called Best Self Wellness. I have a practice of now three, and we're going to be going on to four physical therapists now, and we are pelvic floor physical therapists. Our specialty is in obviously the perinatal space, so I work with a lot of birth prep and postpartum patients. And we are helping moms understand their body through every stage of motherhood, as even prior to motherhood. And that's kind of part. And I grew up here in Jersey City, so a part of my goal is to give back to the community that pretty much raised me.
I have that in common. I also grew up in Jersey City in the Heights.
Oh, no way. I'm in the Greenville area, so
There
that's
you go.
been here all my life.
Yep, pretty much.
Yeah.
Anyway, so Dr. Melanie, I'm excited to ask you a couple of questions. So I see babies right after birth. So about 2 days after they leave the hospital, they come to see us at the practice. And a lot of the moms are really focused on taking excellent care of the baby. And sometimes they neglect their own needs and to take care of themselves. And we check for postpartum depression. We ask a couple of questions, but I feel like we need to speak more in the community about taking good care of themselves because that's the only way they can really pour from a full cup for a baby.
Absolutely. I couldn't agree more. And being a mom myself, I actually just gave birth to my second now. And the mom guilt is constantly on our minds, right? And we pour so much into our children that, and I think even society has even said, like, you need to sacrifice leakage or if they're having weakness. So that's definitely things that is our priority every time that we treat a mom.
So, I understand you take care of moms who have some problems with urinary leakage or
Hmm.
urinary retention or even just weakness.
Yep.
Um, Tell me what your typical mom is like, what problem she's having and how you help her.
Yeah, absolutely. Obviously, during pregnancy, the pelvic floor muscles, all of the muscles are there to support the baby, the growing baby. The mom still has to move around, so your muscles are on overdrive. So essentially, what's going to happen after you give birth, regardless if it's a cesarean delivery or a C-section or a vaginal birth, those pelvic floor muscles especially are usually uncoordinated, right? And so we're looking at those muscles in a postpartum checkup. We're checking to see the strength of those muscles as well as its sensitivity because after a vaginal birth, especially those muscles get very sensitive. And then even if you didn't have a vaginal birth, those muscles being on overdrive, working, supporting the mom and the baby, they tend to be a lot more sensitive to touch. So all of that kind of to make the pelvic floor muscles almost kind of they're supposed to be doing, right? And so a mom is going to go sneeze, cough, pick up the baby. Those pelvic floor muscles are tired, or they forgot what they're supposed to do and when they're supposed to contract and when they're supposed to relax. And so what ends up happening is it can't handle the pressure of that's in your body when you're sneezing and when you're coughing or when you're bending. And so then it allows urine kind of in different varying amounts.
Understood. So you help them with certain exercises, and you're working on their core muscle strength as well.
Absolutely. Yeah, we're looking at all of it, right? We're specifically, so a pelvic floor physical therapist is doing an internal vaginal exam. We're testing each layer of those pelvic floor muscles and we're seeing which muscles can contract and just as importantly, which ones can relax, right? I think every or most people are familiar with the Kegel exercise, right? And so a lot of times people are like, let me just keep Kegling. After you give birth, sometimes A, you don't remember how to Kegel because you've just been pushing the whole time, right? But then the other part is the muscles end up getting really kind of a shock after pregnancy and labor that they actually end up tightening up, right? And so a lot of times we're working on pelvic relaxation we're working on the lengthening of it or the flexibility of it so that they know how to contract and how to Kegel, so to speak, and close the urethra off so that leakage isn't coming out, right? So a big part, it's kind of just like this analogy always being used is if you have shoulder pain or if you're having weakness in your arm and you just keep doing bicep curls all the time, that's like you and having issues with that, you don't just give them bicep curls again to fix it, right? You want to make sure that it's the same thing with the pelvic floor muscles. They've been kegeling this whole time, holding the baby up. They forgot completely how to relax, right? And that's
Gotcha.
also why moms have some pain with intercourse afterwards too, because the pelvic floor muscles are also just really, really out at that point.
Right. Makes perfect sense. So, when do you recommend that moms go to see you? Like, how many weeks after delivery, whether it's vaginal or cesarean?
Yeah.
Um, what are the ACOG recommendations?
Yeah, so ACOG actually recommends that moms to see a postpartum check at 3 weeks and 12 weeks. Unfortunately, with our medical system, with insurances as well, we really just do the 6 week, right? The in between to that, right? 6 weeks is also the point where healing occurred in the uterus. There's reduced bleeding and you're cleared for any sort of infection. So that's typically why they're seeing OB seeing them at the 6 week, and what that's most pelvic PTs are also seeing patients 6 weeks. And so that's typically what I do is I will tell a mom if you're not having any sort of issues, you're not having issues that are limiting you from taking care of yourself or the baby. Let's see me at 6 weeks, only because now I can do an in-depth check and I can do an internal vaginal exam. I'm checking to make sure that the pelvic floor muscles are okay and prolapse. There's signs of prolapse or anything like that. However, because if any sort of issues that are limiting the mom or limiting their function in life, then I'm having them see me as soon as possible. So I've had someone come is they were discharged from the hospital and saw me right away because they were having severe urinary retention. And someone also has severe back pain, hip pain, anything like that, come see me right away because there's no point that a mom should just suffer through their issues, especially because they're having to take care of a baby, right? So you might as
Absolutely.
well, right? Come see me right away. I might not be able to do an internal pelvic floor check. I can check externally. I can check for diastasis. I can see what alignment is looking like and see what exercises I can give to mitigate any sort of their issues.
Perfect. That's exactly what I wanted to know.
Yeah.
It's good to hear that I can send moms who are
Yeah.
suffering,
Yeah.
sooner than 6 weeks. That's
Yeah.
good to know. Awesome.
Absolutely.
Yeah, yeah. The message I just want to give the community and society, I guess, is it's okay for moms to take care of themselves. It's expected that moms take very good care of themselves, not only of the baby. And with a lot of issues, right, in pediatrics, like babies feeding, not feeding enough, feeding too
Yeah.
much, spitting up, and all those things we can easily handle. Right. We have lots of experience with that because we're pediatricians.
Yeah.
A mom is suffering, sometimes we feel a little bit helpless, and it's so good to know that you're out there in the community.
Yeah,
Yeah,
absolutely.
to
I
help.
know, and I that's the biggest thing is I want moms to know that there is help for them. And I think sometimes the answer is when they tell their provider they're leaking. Sometimes they say, "Oh, well, that's normal. It'll get better." And a lot of times it does get better with time sometimes, but sometimes they get better quicker. So, moms to know that they can options out there.
Exactly, exactly. This is great information. Thank you so much, Dr. Melanie, for joining me. So my practice is in Union City and Bayonne, and patients can find us at progressivepediatrics.com, where all our information is there. Um, and our goal really is to take care of for their whole life, from birth until the age of 21, pretty much until they're almost done with college. So we are your child's medical home.
Yeah, definitely. It's to make sure that you guys are around for kids too as well.
Yeah, and tell me a bit about your practice. Where can patients find you physically and online?
Yeah, so my is www.bestselfwellnesspt.com. And my is located in downtown Jersey City. We're not from the path, so it's 190 Christopher Columbus Drive, Suite 2A.
Excellent. All right. So wonderful to speak with you. Have a great day. Goodbye,
Thank you so
everybody.
much.
Bye.